The biggest fear for birth is pain. Every time I talk to a mom and dad who are anticipating or waiting for the birth of their baby, the one fear, secret anxiety, obvious anxiety that people have is pain. I will feel pain. And that now is making a lot of women decide to have an epidural, even, they make the decision before the actual labor. And here's what you need to know about an epidural. So first and foremost, an epidural is an anesthetic medicine given to you through your spine to numb you from the waist down. Now, anesthetic is just a big word we use to describe drugs that actually make you lose sensation and put some form of paralysis so that you're able to not feel pain. So they're very strong nerve blockers. They block your nerve so you're totally painless. Now, again, before I even tell you about an epidural, remember what I say. You cannot run away from the pain of childbirth. It is given, it is there. You probably just have a bit of it. So an epidural, first you need to have an anesthetist, who are the doctors who give anesthetics, put in a needle into a place on your spine called the epidural space. And once they put in the needle has a little tube. They remove the needle and leave the tube in. So it's a very sensitive procedure. An anesthetist will tell you how to position yourself or what position to be in so that you have the needle put in safely. Now you need to also know that it's a blind procedure. That means the doctor does not see where they are going, but because they're trained in doing it, they will be able to estimate how far they go in. So a blind procedure also makes it such that they could sometimes go in a little farther than they thought, because all our frames and our body structures are different. So sometimes you can have little accidents where they went beyond where they're supposed to go. But anyway, they leave the tube in and they will connect that now to a little machine that will be pumping in the drugs. Now that's what we call a standard epidural, and it's what is available in most places. So once you have a standard epidural, so you have the tube in, you have this drug connected to the machine, and it keeps giving you the dosage. What will happen is you will start to get, you have no sensation of pain from your waist down. Now, if you're having contractions, you feel the tightening of the muscle, but you're not feeling as much pain, because what it does is it tries to give you a little room for pain. So you kind of constantly have about 30 to 40% of the amount of pain you have. Not to say that your intrinsic or your actual pain will not keep growing. As it keeps growing, the drug dose keeps growing with it and always constantly leaves you with about 30% of pain. So a lot of women enjoy that, because then you don't have as much pain while you're having your contractions. But you also need to know that once you have made the decision to have an epidural, you cannot run away from all the other medical interventions it comes with, because the particular drugs have a tendency to lower your blood pressure. And that is not good for your own circulation, and especially for your baby's circulation. So an epidural does not go without a cannula, or the little needle that's put on your hand to give you fluids. It will not go without fluid. Yeah, you need to have the fluid to keep your volumes circulating. Because of the low volume that it can predispose you to, you also have a risk in your blood pressure crashing or going down. So you have to constantly have a blood pressure cuff on you so that the blood pressure is monitored at least every half hour. Okay. The other thing is that because you're not feeling the contractions as strong, they need to monitor and see how the contractions are coming, because sometimes when epidurals are given, for some women it tends to slow things down. For some it stays constant, but for a lot of women it slows things down. So they need to see whether you're still having the contractions as you ought to, and with that, whether the baby is responding well to the contractions. If it slows things, then in the drip that they put, you need to have your artificial hormone, oxytocin, put in so that you can keep having the contractions. But baby needs to be monitored. Remember, you have no feelings from the waist down. So things like going to the toilet become difficult. And it tends to numb one of your legs, so you will not be able to get out of bed. And if you do, walking becomes very difficult. So you may be able to pass urine. Some women are not able to pass urine, so they may need a catheter put in that stays in, or sometimes they just get a catheter put in when they need to empty their bladder. So in essence, once you choose an epidural, you are entirely in a medical birth. So it would be unfair to expect that you will walk, to expect that you will get out and use your exercise ball or your birth ball, that you will get out and try to stand, because your leg is weak, and then you have all these tubes and wires connected to you, and most of them need you to be in one space or one place so that they can function or work well. So once you've chosen an epidural, honestly, you're into a medical birth, and you need to take that and understand that. In other facilities, they have what we call a walking epidural. That means it's the same process. You have a little tube left in your spine, and you have this drug that you're pushing in. But with walking epidurals, moms actually regulate the dose as per the pain they are feeling. So they keep increasing it themselves, and you're given a little pump which you carry on your hand. And this is such a low dose that it doesn't interfere with your limbs and your walking, so you're able to walk. But not many facilities do have that. There is also what we call a spinal block. A spinal block will be given at the end of your labor process. The spinal block is a very small dose, and it's just injected into the spine, and you're left with no tubes, nothing running, just the dose injected. And because it's very low dose, it only lasts 2 hours. So once you get that, it means you need to have delivered in the next 2 hours. Now, because of the fact that you don't have an ongoing dose, it tends to relax your muscles very well, and sometimes can actually speed up the process of labor. So a lot of women who get the spinal block get it at the very end, when you're in that phase which we call transition, like you're moving from labor into birth. And once you get the block, it may hasten. But again, all these are medicines, all these are medical interventions. And with childbirth, we have found that one medical interventions many times will lead to another. So be ready for the process or the escalation of interventions. Like if you have the standard epidural, one of the things you may want to be ready for is what we call a vacuum extraction. Because you've had a long time with this drug numbing all your organs from the waist down, when it comes to the actual push time, you may not be able to push. So you will need your doctor to do what we call an assisted delivery or a vacuum extractions. In some places, although a lot less now, you'll have a forceps delivery, and those are some of the things you need to expect. Now, the epidural keeps you pain-free, and for some women, even after birth, if they need any stitching, they may not need any more anesthetic, because they can actually get stitched without the epidural. But that's what it is. That's epidural for you. I hope you got all the information you need to make your decision on whether you want to take an epidural or not. Thanks for watching. Please subscribe. Many times, women are judged by age in many things. How you dress, how you carry yourself, your hairstyles, your makeup. Age always tends to be a factor. And the interesting thing is that age becomes a very big consideration when you get pregnant. So is it justified? Can you actually carry a pregnancy normally and even have a normal baby after the age of 35?
We're sorry, the number you have dialed is not in service at this time.